If you woke up to pee last night, your bladder is trying to tell you something, and it's not what your doctor thinks. Most physicians will send you home with prostate supplements, bladder medication, or advice to drink less water, and none of it will work. Because in 80% of cases, your bladder is completely healthy. It's doing exactly what it's supposed to do. The problem is somewhere else entirely. And the part of your body that's actually causing this has never been checked at your appointments. Subscribe to Dr. Hartman and hit like if you want answers your insurance company isn't paying your doctor to give you. The system makes money when you stay confused, not when you get better. Help this channel reach 1,000 subscribers, and let's fix that one honest video at a time. Picture this. It's 3 a.m. You finally sank into deep sleep, the kind where your body actually repairs itself. Then the signal comes. Faint at first, easy to ignore. You try. But the pressure builds. You throw back the covers, shuffle to the bathroom, squinting against the light. You come back to bed, and sleep is gone. Your mind starts running. Work, bills, that thing you forgot to do yesterday. An hour passes, you finally drift off. And it happens again. You wake up exhausted. You pour coffee into yourself all morning just to function. And you tell yourself, this is normal. Everyone my age gets up at night. Let me be direct with you. That is a lie. Getting up at night to urinate is not normal. Not at 40, not at 50, not at 70. A healthy body is built differently. At night, your brain produces a hormone called antidiuretic hormone, also called vasopressin. It sends a signal to your kidneys: slow down, concentrate the urine, reduce the volume, run in economy mode. That's what allows a healthy person to sleep 7 or 8 hours straight without interruption. When that mechanism breaks down, you get a condition called nocturia, urinating repeatedly during the night. And it's a diagnosis, not a normal part of aging. If you get up once a night, that's a warning. If you get up twice or more, that's an alarm. Because every time you wake up, your pulse spikes, your blood pressure jumps, and you interrupt the phase of deep sleep where your brain clears out metabolic waste, your neurons repair themselves, and your heart genuinely rests. Years of losing that phase is a direct path to hypertension, depression, and accelerated brain aging. Clinical research shows that nocturia stresses the cardiovascular system faster than smoking. That's not an exaggeration. That's published data. Now here's the most important thing I want you to hear. When patients come to me with this complaint, most have already decided they know the cause. Men say, "Doctor, it's my prostate." Women say, "It's menopause," or "a weak bladder." They've been taking supplements, drinking less water, avoiding tea after 6 p.m. They go to bed parched, and they still get up at 3 in the morning. Why? Because they're fighting the symptom, not the cause. Your bladder is a sensor. It's signaling that something is happening somewhere else in your body. In 80% of cases, the bladder itself is perfectly healthy. The problem is not the reservoir. The problem is who's filling it during the night and why. And the answer may genuinely shock you. The culprit is your legs and your heart. But before we get to the mechanism, I need to say something as a physician with 15 years of clinical experience. There are symptoms that should send you straight to a doctor, not to a video. First, blood in your urine without pain. If there's pain and blood, it's most likely a kidney stone or bladder infection. Miserable, but treatable. But if you see dark red or brown urine, blood clots in the toilet, and nothing hurts, that's one of the earliest signs of bladder cancer. In men and women over 50, that finding requires immediate cystoscopy. Do not wait. Second, bone pain combined with sudden weight loss. If your nighttime trips are accompanied by aching in your pelvis or lower back, and you've lost 10 to 20 pounds in 2 months without trying, that pattern warrants urgent evaluation. If none of those apply to you, you can breathe. You're going to be fine. But the quality of that life is worth protecting. And to do that, we need to understand exactly what's malfunctioning in your system. In urology, nighttime urinary problems divide into 2 fundamentally different types. The treatment for each is different, and what helps one type can make the other worse. Type 1 is all-day frequency. You're going constantly, both day and night, large volumes every time. If you measured everything you produced in 24 hours, it would be 3 to 4 liters. This usually has 2 causes. First, you're drinking enormous amounts of fluid. Walking around with a water bottle all day, thinking more is always better. Second, diabetes. Either type 2 diabetes, where glucose pulls water with it, or a hormone disruption in the brain called diabetes insipidus. Urine in this type is pale, almost odorless. and you go just as often during the day as at night. This type needs an endocrinologist and blood sugar testing. Type 2 is night-only flooding, and this is the one we're focusing on today because it affects 60 to 70% of people over 50 with nocturia. The picture looks like this. During the day, you're completely normal. You work, you run errands, you visit the bathroom every 4 or 5 hours. Nothing hurts, nothing burns. But the moment you lie down, the nightmare begins. 3 or 4 trips per night, each time a full bladder, large volume. In the morning, you can't figure it out. You had half a glass of water last night. Where did 1.5 liters of urine come from? This is classic nocturnal polyuria. Your kidneys have switched their filtration schedule to nighttime. They run at half capacity during the day and 200% at night. The critical point. If this is your type, the bladder has nothing to do with it. Treating the bladder is useless. Now let me tell you about a patient. I'll call him David, 58 years old, engineer, methodical, logical, not the type to panic. But when he came to see me, he was desperate. He walked in with a folder full of tests, bladder ultrasound, PSA blood test for prostate cancer, a stack of prescriptions for prostate supplements. He told me his timeline. First, 1 trip a night. He ignored it. Then 2, then 3. For the last year, 4 or 5 times per night. He'd done everything the internet told him to do. Prostate supplements, herbal blends. He'd stopped drinking anything after 5 p.m. He went to bed with his mouth dry, and still, at 2 a.m., he'd get up and release half a liter. At 4 a.m., another half liter. Where was it coming from? He hadn't drunk a thing. When he sat across from me, eyes red from sleep deprivation, I looked at his lab work. PSA, the prostate cancer marker, was normal. He had mild, benign prostate enlargement, but that degree doesn't produce this clinical picture. His bladder was clean, no stones. From a urological standpoint, he was nearly healthy. Yet this man wasn't sleeping, and he was suffering. So I stopped asking about his urination. I started asking about his life. Any shortness of breath? A little. When I climb stairs, I have to pause, but I figured that's just being out of shape. Does your ring feel tight by evening? Yeah, and when I take my socks off, there's a groove in my skin. But doesn't everyone have that? And right then, the picture clicked. I told him something that stunned him. David, throw out the prostate pills. You don't need a urologist. I'm referring you to a cardiologist. He looked at me like I'd lost my mind. What does my heart have to do with it? I'm running to the bathroom, not clutching my chest. But he listened. And here's what the cardiologist found. Early-stage heart failure. Hidden. No dramatic symptoms. During the day, David's heart was working at its limit. It couldn't fully circulate his blood volume, and fluid was pooling in his body tissues, primarily in his legs. When David was taking prostate supplements, he was trying to fix a leaking faucet while the main pipe had burst in the basement. Let me walk you through the physics of what was happening in his body, because it's happening in most of you watching this. Picture a plastic bottle half filled with water. When it stands upright, the water sits at the bottom. When you lay it on its side, the water spreads evenly. Your body works the same way. 16 hours a day, you're vertical, standing, sitting. Gravity pulls everything downward. Blood, lymphatic fluid, the fluid between your cells. All of it toward your feet and ankles. When we're young, our blood vessels behave like strong elastic tubes. The valves inside our veins hold blood firmly. The muscles in our legs, when we walk, contract rhythmically and push blood upward against gravity. But with age, or if we lead sedentary lives, this mechanism weakens. Veins expand, valves start to leak. The muscle pump shuts down because we're sitting at a desk or on a couch. Fluid begins seeping out through the vessel walls into the soft tissue surrounding them. In the loose connective tissue of the legs, up to 1.5 liters of water can quietly accumulate. 1.5 liters, that's 3 large mugs of tea, and you may not even notice it. Your kidneys don't see that water, it's outside the bloodstream. The kidneys filter only what's circulating in the blood. Now comes evening, you get home from work. You have dinner, often with something salty, a sandwich with cheese, cured meat, pickles, and you sit in front of the TV. From 7 to 11 p.m., 4 hours, your legs are hanging down. Gravity keeps working. Fluid keeps accumulating in the tissues of your calves. Then you turn off the TV and lie down. And here's where it gets critical. Your legs rise to the same level as your kidneys and your heart. Gravity no longer holds the fluid down in your legs. All that fluid, the water that collected over 12 hours in the sponge of your tissues, begins rapidly returning to the bloodstream. It's reabsorbed into the veins and rushes toward the center of the body. The volume of circulating blood rises sharply. Imagine someone injected an extra liter of fluid directly into your circulatory system within a single hour. That's not a metaphor. That's exactly what happens to your body every night when you have hidden edema in your legs. And at this moment, your heart recognizes the problem. When the returning fluid from the legs reaches the heart, the right atrium begins to fill and stretch beyond its normal volume. The heart releases a hormone called atrial natriuretic peptide, or ANP. This hormone sends a chemical telegram to the kidneys. Dump the excess fluid immediately, or I will fail. Your kidneys shift into emergency mode. They filter blood at an accelerated rate, expelling water and sodium to protect the heart from overload. The result is predictable. Within an hour of lying down, your bladder is full. You get up, you go to the bathroom, you come back. But the fluid from your legs hasn't finished mobilizing. The process continues. 2 hours later, full bladder again. And the cycle repeats until morning. That's why David, who hadn't drunk a drop of water since 6 p.m., was running to the bathroom all night. He was literally urinating his leg fluid. His legs had stored 1.5 liters during the day, and at night, all of that funneled through his kidneys. No prostate supplement could stop it, because the intervention was targeting the wrong organ. Now, how do you check whether this is happening in you? No MRI, no complex lab work, just your own hands and a few minutes of attention. Test 1. Locating hidden fluid. Sit comfortably. Expose your lower leg, the section between your knee and ankle. Find your shin bone. That's the hard surface along the front of your lower leg with no muscle covering it. Place the pad of your thumb against that bone, roughly 4 to 6 inches above your ankle. Press firmly and hold for 10 to 15 seconds. The pressure should be definite. Remove your thumb and run your finger across the same spot. What do you feel? If the skin immediately springs back smooth and flat, no significant edema. But if your thumb left a pit, a dent that doesn't fill back in for several seconds, you've just located a hidden reservoir of fluid. Even if your leg doesn't look swollen from the outside, that pit is evidence that your tissues are saturated with water. And at night, all of that water will move through your kidneys. Test 2. Simplified urine diary. Take one day and do simple measurements. A measuring cup works fine. Record your urine output separately, daytime and nighttime. Add the numbers. If your nighttime urine output exceeds 33%, more than 1/3 of your total daily output, you officially have nocturnal polyuria. Simple example. Over 24 hours, you produce 1,500 milliliters. If 500 milliliters or more came at night, this is your situation. Your kidneys have inverted their schedule because of edema or hormonal disruption, not because of your bladder, not because of your prostate, because fluid is redistributing incorrectly through your body. If both tests come back positive, the pit on your leg stays, and at night you're producing large amounts of pale urine, we can relax. Your bladder is most likely completely fine. You don't need surgery. You don't need expensive procedures. You don't need lifelong medication. You need to work on your circulation and your daily routine. And that's exactly what comes next. But first, we need to talk about food, because there are 3 things most people eat at dinner that act like a delayed timer on your kidneys, programming them to work at night. Enemy number 1, hidden salt. We've been trained to think of salt as something that comes out of a shaker, but 80% of the salt most people consume comes from processed food. Cheese, cured meats, sausages, mayonnaise, bread. 100 grams of ordinary hard cheese contains as much sodium as an entire bag of potato chips. You don't taste it because it's masked by fat and flavor compounds. Here's how it works against you overnight. You eat a cheese sandwich at 7 p.m. The sodium enters your blood. Your body immediately activates its defense. Too much salt, we need to dilute this. And it begins holding on to every molecule of water it can. In the evening, you're not running to the bathroom. The salt is keeping water locked inside your blood vessels and tissues. But overnight, your kidneys detect this accumulated sodium and begin actively excreting it. And sodium acts like a magnet. It pulls water behind it. To flush out 1 gram of excess sodium, the kidneys must run a significant volume of fluid through themselves. The result? You wake up in the middle of the night not because you drank too much. You're eliminating last night's cheese. Enemy number 2, evening sugar. I had a cup of tea with cookies, a small apple before bed. What's the harm? Let me explain the biochemistry. Simple carbohydrates in the evening cause a rapid spike in blood glucose. Your pancreas fires off insulin. Insulin, beyond managing blood sugar, signals your kidneys to retain sodium and water. First comes retention. Then 2 to 3 hours later, right when you've fallen asleep, blood sugar drops sharply. Your kidneys switch to active fluid excretion. Beyond this, if you have even a degree of insulin resistance, and this affects a substantial portion of people over 40, elevated blood sugar acts as an osmotic diuretic. Sugar itself pulls water out of your cells and into the urine. You get the biological equivalent of a water pill simply by eating a handful of grapes before bed. Enemy number 3, alcohol. Many people tell me, "Doc, I have a small glass of wine or beer before bed. It helps me sleep." Alcohol does help you fall asleep faster. It's a sedative, but it's simultaneously one of the most powerful blockers of antidiuretic hormone. Remember the signal to the kidneys: slow down, concentrate the urine, work in economy mode. Alcohol cancels that signal entirely. Your kidneys run at full filtration speed with no restriction. The sedative effect may let you sleep through the first urge, but the bladder keeps filling. Eventually, the pressure becomes impossible to ignore, and your sleep quality throughout the night is profoundly poor. No deep, restorative sleep at all. You wake up exhausted, with a bursting bladder. Now let's talk about what actually helps. 3 foods that protect and calm the system. Hero number 1, raw pumpkin seeds. Not roasted, not salted. Raw, green pumpkin seeds. Pumpkin seeds contain zinc and magnesium in highly bioavailable form. Magnesium relaxes smooth muscle, including the detrusor, the muscular wall of the bladder. It helps the bladder expand to a larger volume before triggering the urge. The seeds also contain phytosterols, plant compounds that strengthen the pelvic floor. In men, they support prostate tissue. In women, they help with pelvic organ support. A handful, about 30 grams, daily. That's the cheapest and most effective bladder health habit you can build. Hero number 2, cranberry. Not bottled cranberry juice cocktail from the store. That contains more sugar than soda. What you need is the actual berry, frozen or fresh, or a standardized cranberry extract from a pharmacy. Cranberries contain compounds called proanthocyanidins. They prevent bacteria from adhering to the bladder lining. Even in people without acute infection, many adults over 40 harbor low-grade bacterial presence that chronically irritates nerve endings. The bladder becomes hypersensitive. A small amount of urine arrives and it screams, "Empty me now." Cranberry reduces that chronic irritation and calms the lining. Hero number 3, magnesium. Not just from pumpkin seeds. A dedicated magnesium supplement, 300 to 400 milligrams daily. Magnesium has a direct calming effect on the nervous system. It reduces neurogenic overactivity of the bladder. The bladder stops firing alarms at every small sensation and begins operating in a normal, calibrated mode. Practical summary. Eliminate hidden salt in the evening. Remove cheese, cured meats, and condiments from dinner. Eliminate evening sugar. No fruit, baked goods, or sweetened drinks after 6 p.m. Put down the nightcap. Add raw pumpkin seeds during the day, a small portion of unsweetened cranberry, and a magnesium supplement. David did only that. He replaced his dinner of sausage and cheese with a vegetable and chicken salad. He cut the evening tea with cookies. Just from that change, he eliminated 1 nighttime bathroom trip out of 5. Progress, but not victory. Why? Because food changes the biochemistry. But if your venous valves are failing and your vessels have lost elasticity, nutrition alone can't override the physics of fluid. We need mechanical intervention. And this brings us to the most practical part of today's discussion, the protocol that became the final turning point for David. I call it the 3-step tonight protocol, because you can start it tonight, and you'll feel the difference by tomorrow morning. Step 1. Leg elevation. Approximately 1 to 1.5 hours before bed, while you're watching TV, reading, or resting, do this. Lie down on the sofa or floor. Place your legs up on the armrest of the couch, the back of a chair, or prop them against the wall. One requirement: your heels must be higher than the level of your heart. An angle of roughly 45 degrees works well. You don't need to raise your legs perfectly vertical. That strains the neck. Just elevated, comfortable, supported. Stay in that position for 15 to 20 minutes. You can read, scroll your phone, listen to a podcast. What's happening during those 20 minutes? The physics we discussed earlier. Gravity now works for you instead of against you. It pushes fluid from the sponge of your lower leg tissue back into the bloodstream. Blood flows toward the kidneys. Your heart receives the signal of increased volume and releases ANP. Your kidneys shift into active filtration mode. Your bladder begins to fill. But you're awake. You're in control of your evening, fully alert. 30 to 40 minutes after you finish the exercise, you'll feel the need to urinate. You'll go. And you'll release 300 to 400 milliliters, the exact volume that would otherwise have woken you at 3 a.m. You understand the principle. You're wringing out your legs deliberately before you sleep. You're giving your kidneys their workload in the evening while you're awake, so that at night they can rest. Step 2. Empty your bladder completely before lying down. This sounds obvious, but most people go to the bathroom, then spend another 30 minutes getting ready for bed, brushing teeth, checking their phone. By the time they lie down, the bladder has partially refilled. The correct sequence. Leg elevation for 15 to 20 minutes. Go to the bathroom, then immediately lie down. No delay, no scrolling, no last-minute tasks. Your bladder is empty. Your kidneys have done their evening shift. You're ready for uninterrupted sleep. Step 3. Pelvic floor activation. When you're already in bed, lights out, eyes closed, do 20 to 30 repetitions of pelvic floor squeezes. But 90% of people do this incorrectly. They squeeze their buttocks, tighten their abdomen, clench their thighs. That accomplishes nothing. How to do it correctly? Imagine you're trying to prevent passing gas. Or imagine pulling your perineum, the region between your legs, upward like an elevator rising from the ground floor to the 5th floor. Your abdomen must remain completely soft, buttocks relaxed. Only the pelvic floor works, the internal muscle group invisible from the outside. Contract. Hold for 3 seconds. Slowly release. 20 to 30 repetitions. This exercise sends a signal through the nerve endings of the pelvic floor directly to your brain. Muscles toned. Valve holds. The system can rest. The neurogenic overactivity of the bladder decreases. The bladder stops panicking at minimal urine volumes and begins operating in normal mode. That's the complete protocol. Step 1. 15 minutes legs elevated. Step 2. Bathroom, then immediately to bed. Step 3. 20 to 30 pelvic floor squeezes. David started this with skepticism. Doc, legs up the wall? Are you serious? 1 week later, he came back and said quietly, almost not believing himself, I woke up once, near morning. Once, not 5 times. After 1 more month of consistent practice, he was sleeping through the night. His kidneys stopped running a night shift because he was giving them their work in the evening. His cardiologist noted at the next visit that the swelling in his legs had improved substantially. His heart was working with noticeably less strain. This method works reliably because it's built on physiology. It's built on physics, biochemistry, and neuroscience. It requires exactly one thing: consistency. This is not a pill you swallow and forget about. You do this every day. But that's precisely what makes it genuinely powerful. Now, your age matters here more than you might think. The fluid redistribution mechanism I described becomes progressively more pronounced as the venous system ages. Venous valve competence decreases, vascular wall elasticity diminishes, cardiac reserve narrows. Research shows that in people over 50, nocturnal polyuria, driven by peripheral fluid mobilization, occurs roughly 3 times more often than in those under 40. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers, because it will directly shape what I cover in future videos. So let me give you your action plan. 5 steps for tonight. Step 1. Do the thumb test on your shin bone right now. Press and check whether a pit remains. Step 2. On your next day off, measure your total urine output and calculate what fraction occurred at night. Step 3. Remove the salt shaker from your table tonight. Replace your dinner of processed meat and cheese with something without hidden sodium. Step 4. 1 hour before bed, lie down and put your legs up on the back of your couch or against the wall for 15 minutes. Step 5. Before sleep, do 20 to 30 correct pelvic floor squeezes. Only the pelvic floor moves, everything else relaxed. And if the pit in your legs stayed after the test, if you notice shortness of breath climbing stairs, if your socks leave grooves in your skin by evening, don't go to a urologist first. Go to a cardiologist and a vascular specialist. That's the critical path. Your body is not broken. Your bladder is not your enemy. It's a signal light. Now you know how to turn it off by addressing the cause, not by smashing the bulb. I'm Dr. Hartman, and I've spent 15 years watching what happens when people treat the alarm instead of the fire. Most of the time, the damage was entirely preventable. The protocol I just described requires no prescription, no procedure, no money beyond perhaps a magnesium supplement. It requires only understanding how your body actually works and the discipline to use that knowledge. Your doctor is not going to walk you through this at your next appointment. There's no revenue in it. And there's no time in a 12-minute office visit to explain fluid mechanics and pelvic floor neurology. That's what this channel exists for. Subscribe to Dr. Hartman, hit the like button, and help us reach 1,000 subscribers. Every person who subscribes makes it more likely that the next person who needs this information actually finds it. The healthcare system profits from managing your symptoms indefinitely. I profit from you not needing me anymore. Subscribe if that difference matters to you.